activity.
Researchers have suspected that the eating disorder anorexia does have a genetic component to it. And a recent study found that there is indeed a number of genetic links between anorexia and other mental health disorders, which may not be surprising, but also links to some physical traits like a person's metabolism and a natural body weight. Not sure exactly what we can take away from that. It is only one study, but I'm so happy to have with me to put in some perspective for us a psychiatrist, Dr. Mirjana Domakonda from the Institute of Living in Hartford. Thank you so much for joining us today.
Thank you so much for having me.
Yeah, glad to have you here. I don't know what to make of this study. It was sort of billed as maybe possibly someday leading to medication-based treatments or at least a different understanding for anorexia, but you're an expert. What's your take on it?
Well, so just to give you a little bit of background, the study is fascinating because it's actually a large international study that looked at the DNA of about 17,000 people with anorexia, which is, you know, a significant amount, and actually looked to see whether they, like you said, had any genetic links to both psychiatric disorders, which we already believe is there, but also to metabolic disorders and variables like weight and cholesterol and even type 2 diabetes.
Physical activity too.
Right, and even physical activity, because we know that those are often disrupted in anorexia. And you know, what we used to think was that anorexia maybe cause some of those metabolic abnormalities because of the starvation and malnutrition that often happens. But what this study actually suggests is that people with anorexia may have a predisposition to these metabolic risk factors that actually make it harder for them to gain weight once they lose it, or make them more susceptible to anorexia, which is different than what we thought before.
And hopefully that will lead to new avenues for treatment. But in the short amount of time we have, why don't we talk about what's necessary for treatment? You were just saying a couple seconds ago, early intervention, especially for people out there if you're worried about your children, is so key.
So I think the first thing to remember is whenever you are, suspect somebody may have anorexia or eating disorder or any difficulty, is to get them help as early as possible. And that for anorexia specifically means making sure that medically that they're stable, like making sure that they're not so malnourished that their heart is suffering or that they have other hormonal abnormalities, because those can be deadly. And the next step is really refeeding, getting them back to a normal, healthy weight, which can take a lot of time, but I think it's important to find the centers that do that and do that well with therapeutic support. And then finally, ongoing therapy. So, unfortunately, we don't have FDA-approved medications for anorexia, but we do have some that help some of the other psychiatric comorbidities like anxiety and depression that could contribute to, people getting worse.
Cognitive behavioral therapy, that's still sort of the gold standard?
So cognitive behavioral therapy, or CBT. There's also family-based therapy, which is really getting the whole family involved to support people, because obviously that's a huge component, especially for adolescents, and adults, right?
Absolutely. So that's just some of the avenues you can go down should you suspect a loved one has anorexia or bulimia, any real eating disorder. That's something that is a specialty of the folks at the Institute of Living in Hartford. Dr. Domakonda, thank you for spending the time with us this morning.
Thank you so much.
I'd love to talk with you more.
I appreciate you spreading the news.
Thank you so much. Okay, let's get over for one last check on weather.